So this handsome fella is Charlie, and he's 5 years old. Now, he got attacked by a bigger dog 2.5 weeks ago now, and he was really bad. The owner thought he had died. He was out cold and stiff, but eventually he came round, so the owner took him to the vet. They treated him for his wounds, and immediately that night the owner noticed that he was drinking more than normal. We're actually now in COVID-19 lockdown, and she was moving from up north down to us. And so yesterday morning he actually did 3 vomits, which concerned her. He was still drinking excessive amounts. So being a Saturday morning, we admitted him, run some blood tests in the clinic as much as we could do. And I was also concerned maybe it was a tummy upset with the vomiting, so we've done x-rays, and of course I've put him on a drip. So what I want to teach you is actually how to measure how much water they are drinking, so we can just tell whether it is actually excessive or not. So he's about 15 kilos, so excessive would be 100 mils per kilogram. So that means if he's drinking more than 1.5 litres, that's getting excessive. And then we'd be worried about diabetes, kidney issues, could still have a bladder infection or something else going on, but often the hormonal conditions do cause an increase in drinking. So what you do is get a big bowl that will hold, say, 1.5 or 2 litres, and then we measure exactly, either by a cup or a measuring jug if you've got it, and measure into that bowl. Doesn't really matter how much, but measure into that bowl a set amount. Now, if you put in, say, 1 litre and it's getting down, then just measure an extra bit and top it up. So what we do is we set it all up at a set time of the day. Maybe it's 9 o'clock in the morning or lunchtime, or even start in the evening, but remember the time you start, and then 24 hours later then you measure how much water you've got back. So then you can measure exactly how many mils they've drunk in that 24-hour period. Now the idea would be also to do it daily for the next 3 or 4 days and get the average. It doesn't really work that well if you've got more than 1 dog in the household. So if we really want to know, then it might be a good idea to isolate them to a separate room or area so they only have access to that bowl. Remember also, don't let them drink out of streams and things when you're doing this, because it will muck up our measurements. And if need be, you can add an extra bowl, but just make sure that the extra bowl inside and outside, you've measured that water, and then 24 hours later you measure it back. So that's a handy tip, certainly helps the vets in their diagnosis. Of course, the other thing that might be happening is the dog might be peeing more because it's drinking more. And so the vet may ask you to get a pee sample. So we'll give you an idea of how to do that in another video. But that is Charlie, and we're going to be interested to find out what we find. We've ruled out diabetes mellitus at least. The glucose diabetes. His kidneys are all okay, his blood work was pretty good, so there's just a few more hormonal conditions that we need to look into, which we'll do more tests when the lab's open. So I'd be a wee bit concerned that Charlie might have diabetes insipidus, just because his urine is really quite dilute. We're talking a specific gravity of 1.005 or 007. So for those of you that understand what that means, that's pretty much like water. And there's not that many conditions that actually cause it to be that dilute. So we'll just have to watch and wait for our results from the lab, and then maybe even try him on some medication. But it is quite a sad thing if that is what he's got. But it does fit the history of the trauma to the head is one of the things that can cause it, either that or tumours and different other acquired problems, but he's pretty young, so I don't think it's a tumour, so I would be betting money the fact that it happened soon after a dog attack, like that night. That's pretty amazing. So just a pity the big dog wasn't on a lead. If it was on a lead, this might not have all happened. So poor wee Charlie, but at least he's bright and perky and still happy. And as long as he's not deprived of water, he can still drink plenty. It just would be nice to keep that under control because he is still a bit of a risk of getting dehydrated. So he needs really to be on some treatment.